am Norhana Pandara, an ETF BSN student, and today I will be performing IV insertion. The another way of administering medicine or fluid to the patient's body is through intravenously. First, we have to verify the prescription of the doctor and the purpose of the access. Introduce yourself and verify the patient. Good morning, sir. How are you?
I'm fine.
I am your nurse today, Norhani Pandara,
Yes.
and your doctor asked me to give you IV insertion. Okay?
Okay.
May I know your name, sir?
Risky.
Rizky.
Agustion.
Okay, when is your birthday, sir?
January 15,
Hmm.
0.
Sir, I will be right back to give the to take these materials needed. Okay?
Okay.
For now, you can take a rest. Okay?
Okay.
Then we have to gather the equipments needed. We will need tourniquet, IV cannulas. IV cannulas depends on the size of the vein of the patient. Alcohol swab, plaster, infusion set. Make sure it's intact and not expired, and the prescribed IV fluids of the doctor. Make sure that it's not expired and there's no discoloration on the fluid. And of course, we will need disposable gloves to protect us and the patient, of course. And then we have to perform hand hygiene or hand washing. The patient's bed to a comfortable work level. I have to set up the IV set. Check for coils. Select which site you will use. After selecting the site, apply the tourniquet. Then disinfect the site with alcohol swab. This is to prevent infection. Using the non-dominant hand, hold the skin taut about 1 to 2 inches below the venipuncture site and anchor the vein. Align the IV catheter with the vein, with beveled side up. At a 10 to 30-degree angle, puncture the skin. Advance the needle into the vein. Once the blood is visible in the flashback chamber, continue to advance the catheter about 0.25 inches into the vein. Slightly pull the needle to make sure there's backflow, and then advance the catheter. And then release the tourniquet. Secure the site with a plaster. Completely remove the needle and then attach the catheter to the IV set. Secure the site with another plaster. Clean your working table and make a note with name, date, time, and number of drops per minute for the IV drip. And lastly, perform hand hygiene and document the procedure you have done.